hard to believe, but the 2020 Kentucky General Assembly kicked off on Tuesday, January the 7th. I'm Dr. Brent Wright, current president of the Kentucky Medical Association. I'd like to take a few minutes to share the KMA's 2020 legislative priorities, as well as urge you to get involved to ensure this session is a success for both Kentucky physicians and our patients. As with all even-numbered years, this session will last for 60 days, and legislators will need to pass a 2-year budget. While that certainly makes for a lot of ground to be covered, the KMA is prepared to be a leader in these discussions to ensure the voices of physicians and patients are heard in 2020. Our first area of focus is public health. During the 2020 session, KMA will seek the removal of prior authorization requirements for medication-assisted treatment, commonly called MAT, and ask that payers be required to cover non-opioid pain treatments such as physical therapy, massage therapy, and acupuncture as an alternative to opioids. Tobacco will also remain a focus, with support for an e-cigarette vaping excise tax and raising the level of funding for state tobacco prevention and cessation programs. Although the legal age for purchasing tobacco products was just increased to 21 on the federal level, Senator Ralph Alvarado has filed additional Tobacco 21 legislation on the state level that would remove any conflicting state statute language and take additional steps of removing certain penalties that could be brought against youth who violate the 21 rule. This puts greater emphasis on those who have more control over the situation, the retailers. KMA will also prioritize public safety by protecting the patients of the Commonwealth from deceptive drug injury advertisements through a number of new regulations. In addition, we will support requiring that vision testing become part of the driver's licensing renewal process in an effort to reduce automobile accidents. Access to care will also be a main focus of the association. If Congress fails to act on federal surprise billing legislation, the issue may return to the states for action. KMA has been very active on the state and federal level regarding this issue and will continue such efforts to avoid having a government-mandated rate set for out-of-network services. KMA will also advocate for legislation that would prohibit payers from enacting copay accumulator policies that do not count third-party financial assistance, as well as support a cap on copays for insulin. KMA will also be advocating for change through a new website designed for physicians and patients to provide feedback on challenges and roadblocks they experience firsthand in providing or receiving health care. aimforbettercare.com serves as a platform for both patients and physicians to share their stories of cost increases, delays, and denials. KMA will then use these narratives to assist in advocacy and education efforts to improve upon or eliminate such issues. We see this as an opportunity to improve public health through a combination of legislation, policy changes, and greater awareness. And I'd encourage you to share your stories at aimforbettercare.com. Membership-driven grassroots advocacy will of course be essential to achieving success. KMA will host its annual Physicians Day at the Capitol on February 6, 2020, and physicians are encouraged to attend, engage their legislators, and educate them about these and other issues that are important to physicians. More information and registration for Physicians Day at the Capitol is available at www.kyma.org. If you haven't already, please sign up for KMA's free legislative text alert service, which can keep you updated on all the happenings in Frankfort. Simply text KMA to 50457. Please also be on the lookout for KMA's weekly legislative bulletin email, which is distributed to members each Tuesday during session and provides important information for physicians on these and other key issues. As always, a number of impactful healthcare-related issues will be discussed, debated, and voted on during the 2020 session. KMA will be there as the voice for physicians and their patients to advocate for policies that promote quality, public health and safety, and the practice of medicine. Thank you.